Hello students, in this video we will be taking a look at something called as pitch, roll and yaw. Pitch, roll and yaw is one of the most common doubts that I've been asked by students to explain again and again. So I thought we shall put a small video regarding this during the revision so that when you're after your studies you can just take a look at this video and be clear with what is pitch, roll and yaw. So before we go into the pitch, roll and yaw per se. So pitch, roll and yaw was first introduced in the Ackermann-Profit classification. Ackermann-Profit classification is one of the most systematically constructed classification of malocclusion, which includes a lot of criteria. This is a Venn diagram showing the Ackermann-Profit classification, and these are the 5 components of the Ackermann-Profit classification. I'll just go into a bit of brief about this. The outermost rectangle contains dentofacial appearances, which includes the profile, the asymmetries, the lips, incisor positions, etc. The outermost circle shows the alignment and symmetry of the teeth and the arch form. There are inner circles which forms the Venn diagram, which overlaps each other, describes each malocclusion in each transverse plane. Planes. One is the transverse plane, sagittal plane, and the vertical plane. So if it's in the transverse plane, malocclusion includes cross bite, narrow arches, and scissor bite, which means abnormally large arches. Sagittal plane is your angles class malocclusion, class 1, class 2, class 3. And vertical plane malocclusions includes your open bite and deep bite. So what happens is, all malocclusions are not just along one axis. It can be any sort of rotation along an axis. So that's when this pitch, roll and yaw came into the Ackermann-Profit classification. So consideration of both translation in 3D space and rotation about a perpendicular axis, which should also be considered while classifying a malocclusion. So that gave rise to, you can see, pitch, roll and yaw. So what is pitch, roll and yaw? We'll see in detail. So pitch is nothing but an excessive upward or a downward rotation of the dentition. This rotation can be in relation to either the soft tissue or the rotation of the dentition in relation to the skeleton. So if you're looking at a patient, if everything in the skeleton may be normal, but the gingiva may be excessively visible, so or the lips may be very short, revealing a lot of the upper arch, which means that the arch is either up or down in relation to the soft tissue. This will be visible only when you clinically examine a patient. There can also be a skeletal component to pitch, in which the maxillary or mandibular dentition itself may be rotated up or down in relation to the facial skeleton. That will be visible in a cephalometric radiograph. So whatever it is called as pitch. You cannot call a tooth that is extruded. Dental up or down rotation will not be considered pitch. It's mostly skeletal. So pitch is revealed as the when you see in a cephalometric radiograph, where you take the palatal plane, occlusal plane and mandibular plane in relation to the true horizontal plane. If these planes are either tipped up or down in relation to the true horizontal, then it is called as a pitch. We'll see a small example. In this patient, you can see the dentition is fine, but severe deep bite, however, is seen. But you can see in relation to the face, the teeth is not at all visible. The entire maxillary arch is tipped downwards. So this is a downward pitch. This patient also, it's the same. So such finding is called as a pitch. Next is a roll. Roll is analogous to the banking of an airplane. This banking of an airplane is an important question. This was asked in this NEET exam, which is considered to be analogous to a banking of an airplane. So that is called as a pitch. What is banking of an aeroplane? When an aeroplane moves from the side to side, wings move up or down, this is called as a banking of an airplane. The same way roll happens. If either of the jaw is rotated like this, it's called as roll. It's like rolling of the aeroplane. This relationship can be just like pitch. This relationship can be either with the soft tissues or the rolling of the dentition with that of the skeleton. There is roll of the skeleton with that of the facial skeleton, you can check with the Fox plane. We can keep a plane in the patient's dentition and see if the Fox plane is straight or not. If that is the case, it can be easily evaluated. But the dentition and the skeleton can be normal, but the roll can be just with the soft tissues. When the patient smiles, the smile can be crooked. I'll just show you an example. You can see here, this patient's smile is crooked. The occlusal appearance of the smile is sloping downwards. So this is a roll. In this patient, however, the patient has a skeletal roll, in which the Fox plane you can see in relation to the interocular distance, and the occlusal, you can see that it is slanted. But however, in this, the patient's dentition is normal with the intraocular, but the soft tissue is banking up or down. So this is called as roll. Roll is up or down along the transverse axis. Next is yaw. Yaw is rotation along the vertical axis. Rotation of the jaw to one side of the other. Mostly it shows up as a midline discrepancy, dental midline discrepancy. However, just dental midline discrepancy due to tooth movement is not considered yaw. The whole arch should be rotated. The maxillary dentition should be rotated along in relation to the maxillary arch, or the whole skeleton can be rotated in relation to the soft tissue. So pitch, roll and yaw can be either in relation to the soft tissue or in relation to the skeleton. Both are applicable, but dental roll or dental yaw is not considered to be pitch, roll or yaw. Dental discrepancies are dental discrepancies only. So the yaw of the dentition in the it can be either in the maxilla or the mandible. Generally it shows up as a midline discrepancy and also as a subdivision malocclusion. Unilateral class 3 or class 2 molar relationship will be there, because one arch will be rotated, so molar relationship will be changed. This midline discrepancy or rotation of the jaw has not been included in any type of classification of malocclusion. Only Ackermann Profit has this type of subdivision. So you can see in this picture, this is the patient's midline, facial midline, and the entire arch is rotated towards the patient's, towards my right side. So this is called as a yaw. This also you can see, the patient's, it's rotated towards the left side. So to summarize, what is pitch? Pitch is the upward or downward deviation along the anteroposterior axis. This image can be a little misguiding. I'll just tell you how it works. You can see pitch is in red, roll is in yellow, and yaw is in blue. So this yellow line is the anteroposterior plane. Pitch is the rotation perpendicular to this plane. You can see, that's why it has been mentioned in red color. This line, movement of this up or down, is called as pitch. So remember, pitch is deviations around the anteroposterior axis. They can ask this as an MCQ. Please note it down. Deviations or up or down movements around the anteroposterior axis. Anteroposterior is from your front to back. If it deviates up or down, it is pitch. It can be either result in a deep bite or an open bite malocclusion. Next is roll, up or down deviations along the transverse axis. This is the transverse axis. Deviations in the transverse axis to this side, like this. Transverse is towards bisecting me. So transverse axis up or down is roll. Yaw is very simple. Vertical axis, the arch can be moved towards the right or the left, shows up as a midline discrepancy or a unilateral class 2 or a class 3 malocclusion. So this is all about pitch, roll and yaw. It's a very simple concept, but a lot of students get confused. So that's why I have made this small video to help you understand. Thank you.